Good morning, friends. Let us start another version, another small topic onto my pharmacological classifications, where pharmacology made easy. And in the previous two classes or previous sections, we were talking about the deeper of your pharmacology. But today, just I want to take a generalized topic of COVID-19, which is little bit popular today, and we are in the positions of lockdown. And the first two videos we were talking about the COVID-19 symptoms and how the action of hydrochloroquine and the chloroquine has been done, and the mechanism of actions, how we are being demanded by the other countries for the import of for the export of these medicines, particularly America, who has been asking and requesting for all this. And previously we were listening about another topic, what is called as convulsant plasma therapy. And up to now, the FDA, that means the Food and Drug Development Act, cannot give you permissions for this particular drug therapy. But later, little bit investigations have been done, and more curations of this coronavirus has been done. So it make it into action so that we can start using this convulsant plasma therapy, so that the patient's risk will be little bit lesser. And now today, just it's a small topic, and I want to discuss about this convulsant plasma therapy. Actually, it is a very, innovative way of thinking how we need to save a life regarding these diseases. We know that in order to control various diseases, we always accept sometimes of vaccines. And in the childhood itself, that means at the weight of fetal 1 month and 6 months babies also, we need to go for the vaccines, isn't it? For your polio vaccine, BCG vaccine, and typhoid vaccine. So different types of vaccines will be there. And what is the purpose of these vaccines is, the vaccines are the provisions which are supply you antibodies inside the body, so that it will fight whenever that particular disease will be inside it. So that is the main aim of our vaccines. And here also, this is a small, not actually full version of vaccine, we can say that, but we can say that it is a smaller version of your vaccine. That means we are trying to give something antibodies to our body. We know that there are two types of versions always we speak about, antibodies and antigens. And antigens are, that means it is all been represented by AG. Antigen is something which the pathogen, that means the infective particle which is being induced inside, that is called as antigen. It stands for AG. So whenever a pathogen has been entered inside, our body starts building some antibodies. We call it as antibodies. So that is called as AB. And these antibodies are something which starts fighting with these antigens. That means there is always a fighting with a bad against good, or we can take that evil against good, or demon or the monster against good. So what happens in this activity also, we can say that the antigens are always the monsters which are being supplied to the body. And also in that category, these antibodies will be taken in our body. That means we synthesize our own antibodies with the help of two glands. One is called as thymus gland from the lymphatic system, and the other one is called as T cells, which are being produced from the bone marrow. So these are different types of antibodies. It starts working, the body works with that, and so it synthesizes some antibodies and supply to the antigen, so that there will be a mutual understanding between whoever fights the win, they will come into the condition. If at all antibody wins, we can know that our body will get cured. If an antigen wins, you get your disease. So here also the coronavirus, now what of all, it is more potent. Why? Because it has been rapidly spreaded all over the world in the pandemically. That word is called as pandemic. And here and in India also, in all the other countries also, they started giving you this convulsant plasma therapy. So we can understand what it is. This is convulsant plasma and therapy. We have three words here. One is convulsant. So what is convulsant? Convulsant is a meaning which is giving you a recovered patient. That means who been cured of that particular disease. So if you take corona into the condition, we have to understand that that patient is being covered with coronavirus. He rebacked with the coronavirus and he became negative. So from the positive conditions, he became negative conditions. So that particular person is called as a convulsant person. or recovered person. So that word is called as convulsant. And now coming to plasma. We know that our blood is being supplied with two. One is the plasma and the one is RBC, which is having both the categories. That means the cell category and the plasma category. So whenever this RBC, WBC are being producing their own activities, we can't do the work with the plasma. So what happens? This plasma is divided into, that means the blood is divided into two parts. One is the plasma part, which is the liquid part, in which the cells are being storing. So now we are not having any work with the cells, but we are having only the work with the plasma. So what happens? They centrifuge our blood, and that centrifuge is being taken by a therapy called as plasmapheresis. This plasmapheresis is something which is dividing both RBC, and that means the cell part, and also the plasma part. It is divided into two. So this plasma part will be having more and more capacity to hold the antibodies, and the RBC part is nothing but which fights with the antigens. So that is not important for now. So what happens, whenever a patient has been recovered with him, he wants to take, that means this body is filled with more and more and more antibodies which is been working against that coronavirus. So what happens, whenever the person is been recovered himself from the back, still he have the lot of antibodies inside him, particularly for holds for 1 year inside the body to fight against the same. If at all he gets the same, he have to fight one more time, isn't it? So what happens, the person will get more and more inhabited, or he gets used to that particular antigen, and that stage will having so many quantity of antibodies of coronavirus diseases one, and so the person holds them, and those will be holded by your plasma. That means the blood quantity will be having that. So what happens when we are trying to treat another person, and particularly this plasma therapy is only aimed for two persons. Who are those two persons? Is the person who is more serious to death, or that times he is almost to the death. So there are two places of making this plasma therapy into the condition. So what is the two qualities are, one is the serious condition, that means almost to the 80%, and the life threatening process, that is equal to death. If you are not able to give supply immediate antibodies, he'll go to death. So these are only two versions which can be controlled with plasma therapy. So what happens, this plasma will be recovered, will be covered, or will be taken from the patient who is all been recovered by the virus. So that process is called as plasmapheresis. And this FDA, that means the Food Development Act, is that type of drug actions will be taken into action and give you permission. But we need to understand one clear point, that this FDA is not providing you or collecting you or supplying you the plasma therapy. It is just gave you only the permission, the terms, the conditions, the rules and the regulations. The other qualities will has to be done by a qualified clinical centers. We have different types of clinical centers, and you can understand that. And here I gave you that this can be taken into condition. So suppose we are in a position to offer something, right? We are donors, and we want to give you something recipients. So we want to give a collection by the clinical centers, or we want someone to donate for us. So what happens at that place, when what we need to contact? Here I gave you the numbers and also the mail called as COVID-19@FDA hhs.gov. This is a mail address what they gave you, and if you just give your dial to that particular center with the number 1-866-300-4374, and if you start ringing to that particular center, they'll respond you within 4 hours, and if you mail also, they'll respond you within 4 hours. So what happens, we can give you the specifications, all the specifications, and what we needed, whether we are a donor or a recipient. So what we have to tell all the qualities what we have. So they gave you some specification regarding the patient and regarding the donor. That means the person who is donating, the person who is receiving. So the person who is receiving is a recipient, the person who is donor is a donor. So here I have given you some qualities of a patient for who the qualities are being intended. Here this apnea, this is nothing but the less breathing, that means there is no breathing itself, you have some tiredness in breathing, that condition is called as dysapnea. So this is the first condition what the patient should have. Next you have respiratory frequency. Always the respiratory frequency between your limits, we can't cross that respiratory frequency. So what happens, particularly this patient who is suffering with your coronavirus in a serious condition and the life-threatening condition, that respiratory count will be greater than 30 minutes. That means the beats, the respirations, inhalations and exhalations will be greater than 30 per minute. So the counting should be evaluated by the specified clinical persons. And also we have different types of saturations. That means our blood is always supplied with oxygen, and that oxygen should be in a saturated position, and that is also count is given blood oxygen saturation count, which will be not less than 93%. And here you have given you two words here, one is PO2 and the one is FO2. PO2 always our lung volume, that means the inspiration and the expiration will be measured in the form of tidal volumes, and always this pressure will be calculated with a partial pressure. So it is called as partial pressure of oxygen, and this is called as frequency oxygen pressure. So what happens, they'll give you a ratio which has to be lesser than your 300. That count should be particularly to that area. And also the lung infiltrates. This is nothing but we have different types of lung infiltrates. That means we have different types of eosinophils, lymphocytes, monophils, basophils. So these type of infiltration has to be greater than 50%. That means if it is lesser than 50%, that means you are more and more immune to and goes for the life-threatening process. So that we cannot proceed. So infiltrate should be always greater than 50%, and that 50% should be always maintained within 24 to 48 hours. Then only we can prescribe for that particular patient with a plasma therapy. And next, this is called as respiratory. And what are the different types of life-threatening? That means I told you two conditions, isn't it? And up to here, this is qualities of the serious person. And now this list is for the life-threatening persons. Once this coronavirus has been stopped leaving your lungs, it has to be spreaded to other areas. Particularly, it starts spreading to brain, it started spreading to heart, and later it starts spreading to kidneys. So these are the three main organs we can call vital organs. And here the respiratory failure, that means the full collapse of your respiratory system is being down. And also this is called septic shock. This septic shock is nothing but the decreasing of blood volume. That means the decreasing of your blood pressure. And when you start reaching to this place, that means the person is trying to go for your next version, what is called coma. So this has to be recognized, diagnosed, and also as I told you before, it has been transformed from lung area to brain, lung area to heart, and lung area to the kidneys. That is called multiple organ failure. Once it has been invaded to the other organs also, the whole collapse system of organ systems will be failure. And when you receive these three areas, then means that this person is having life-threatening qualities. So these are also has to be recognized, and this person is called as serious person, who is always 80 to 90%, and this is almost to the 90 above %. So this is called as multiple organ failure. So these are the qualities of your patient, and whenever the patient have all these specifications, he can consult. That means the ones who have been closer ones then can consult this mail address and the phone address, so that they can contact you within 4 hours, and the person can be saved with a provision of antibodies. So as I told you, the plasma is fully developed with antibodies for the convalescent person. Now we'll see what are the donor qualities he should have. And here I've indicated all this. So if at all the person is interested to take the donor system and he is recovered from the coronavirus, and he starts going out of the hospital, he can take a chance, or he can have a little bit humanity so that he can start giving some donations to it. And if at all you know that, you can go for that. Otherwise, you have some awareness so that the person may have, who can be recovered from that particular situation, we can ask that person to donate something. So what happens here, the blood transfusion is not required over here. That means the blood taking the blood inside, blood transfusion, blood, we know always we take blood something if we have some less of but here the blood is not at all required. We require only the plasma what is being supplied by the blood. So what happens, they collect usually. What they collect about 400 ml, isn't it? The 400 ml of blood is just enough. What happens, that blood will be taken by a plasmapheresis treatment, where it is being divided into plasma and the cells part, and they collect only the plasma part which consists of antibodies, and it is being taken for the neutralization of, that means neutralization, what that particular plasma which is having the amount of 200 to 400 ml should have an equal ratio of 1:160 ratio, and that particular donor will have to keep that particular antibodies in the frozen condition at a rate of -18 degrees centigrade, and one particular, if it is been taken, it can have an expiry date of 1 year. That means he can be stored for that particular antibodies in a frozen condition, particularly for 1 year. If any recipient asks for that particular antibody treatments, he can acquire and take it into action. So whenever we have to take this into condition, this is just an awareness so that we know what is a convulsant plasma therapy. And now in this previous 15 days, there have been many patients who have been getting all this convulsant plasma therapy and getting into the conditions of negative. So just get an awareness what is convulsant plasma therapy and what is the importance of this particular therapy. Thanks for listening, and we'll go for another section in the next class. Bye.